So I think it's the exact same journey and challenge that we face in healthcare. There's no way to get around. Like, the currency for progress is evidence and data, and clinical credibility gets you a long way. There's a lot of wellness vendors out there. We have got some ground, made some ground 5-10 years ago, but like, even employers are more sophisticated and want to know talking who's talking bullshit, who's got actual evidence to suggest, and studies and things to suggest that what they're doing is actually true or working. And for us, like, I'm like a complete outsider. I don't have an academic bone in my body. Like, I've passed exams and got through tests to get into programs and things, but I've never really done rigorous scientific research. And Jake is also from a consulting background. He's arguably more qualified than I am in the healthcare sphere, but we've always leaned on other people to try and leverage their skills, their budgets, their motivations to get things that as a byproduct also benefit us. So, and at the same time, just be the nice guy. Just by being patient and humble and just kind of acknowledging that they know more than you do, and that we're here to not change the way they're doing things or say what they're doing is wrong or could be done better. We're here to try and make their life easier. I mean, it sounds cliched, but like, in healthcare, there's a lot of people who work sort of 9 to 5 and have very kind of defined roles in their jobs. And if you can't really make an argument that's very empathetic to like their day-to-day life and work, they won't listen to you and they won't, bat for you. Whereas, that's kind of very high level, but more specifically, I guess, the first step in that evidence gathering would have been medical center back in 2019, where we found out just through multiple phone calls and following some breadcrumbs and some luck that their tobacco treatment team and their respiratory team had like a tobacco treatment meeting once a week or once every other week on a Thursday, where they would get together and discuss better ways of helping their inpatient smokers and outpatient smokers. And we got to sort of sit in on that meeting, and our was, we've learned something, we've experimented with some things, with some tech prototypes that might be interesting to you, because you lose visibility of your patients when they leave the clinic. But we know you care about your patients, or that you want to know how they're doing. You wish they would like check in with you. I think we might have an answer to that somehow. Let us share what we've learned. Like, it wasn't us saying, hey, tell us what you've learned, tell us what you have for us. It's the opposite. Like, let me share something about what we've learned that could benefit you, and maybe if it benefits you, it'll benefit us, like, not saying it explicitly like that. So that's always kind of the premise of our conversations with practitioners in healthcare. And then from there, you kind of become friends with them. You learn about their cats, you learn about their kids, you learn about, you hang out with them in the cafeteria. You kind of dispel any prejudices they might have about, some Harvard dudes wanting to chat to you or whatever they might think, with the connotation. And then, and then just be patient. Like, it was only like earlier this year, like in June, that we had a clinical study, some data published from a study that we did with them, where, again, for that study, like, we had applied for some kind of grant through the state of Massachusetts, and we asked medical center, after building that relationship with them and kind of earning their trust and building some basic tools and asking them what they think. Eventually ask them if it's okay if we put them like a host for this study or for this grant, and started to design a study around them doing the work and kind of cash payout and paying for some of the staff part of that grant. So really like hand-holding through a process of allowing them to discover whether this thing was useful or not, without them having to find the money or them having to really do much work on their part. So that's the other thing, just like don't ask people to do work for you, like try and do as much of that work